about the coronavirus for a little bit. Dr. Diana Cervantes with the UNT Health Science Center joining me right now in the CBS 11 Green Room. We've got a lot of new developments since you were here the last time. First up, I want to talk about Dallas announcing today that they can do the test for coronavirus instead of having to send it to the CDC labs in Atlanta. Why does that make a difference?
So that's going to be really helpful in being able to quickly identify people who may have this coronavirus. And there was a big delay previously. So right now there are people who have had travel to high-risk areas. So even, for example, now Italy and other areas. And so if they come and they're self-monitoring for any signs and symptoms and they needed to be tested, before it was a bigger delay to have to take it to CDC, have it shipped to CDC and have it tested. The other thing that recently changed is now there are more, the testing criteria is broader. So then it does allow for more people to be tested. And now with the lab capability in Dallas County and soon to be as well in Tarrant County, it just allows for more potential detection.
Yeah, and quicker detection too. The other thing that I was curious about, you know, we've seen some of the cases where it's spreading through communities, and you know, some people have had direct contact with other people who have been testing positive, but in some of these cases there's not exactly that same sort of connection. Can you kind of explain what's going on with that realm?
Yeah, so now that we are seeing more sustained person-to-person transmission in multiple areas of the world, it's definitely possible that somebody had traveled, or even if they hadn't traveled, somebody had traveled and they had had this exposure, and even if they had mild symptoms and they exposed somebody and that person didn't have the travel, then that person could get sick. So there's a lot that we are still learning about this infection, but we do know 80% of the cases have very mild cold symptoms. So they may have come into contact with somebody who had the virus and didn't even know it.
And see, that's something I really do want to point out, because I want to put it in perspective. You know, how concerned should people be? I think they hear about this spread and they hear about the worst case scenarios, but as you were saying, 80% of people, it's going to be more of a common cold sort of thing.
So we definitely need to think of it more like the flu. So when we think of the flu, yes, there are people who get the flu and they do not have very severe disease, but there are people who are at high risk for severe disease, for death, and those are going to be the elderly. So for example, that's why we are seeing so many deaths, unfortunately, in Washington in the nursing home. So we have to put it in perspective that yes, even though we don't have a vaccine and we don't have antivirals, the way that we are seeing with cases is that yes, if you're generally healthy, you're young, you're going to have mild symptoms.
Would they be symptoms that necessarily you would even actually go to the doctor for?
Not necessarily. So you may just have a mild runny nose. You just might have a mild cough. And that's what we're trying to learn more about this virus. And so now that we do have more testing capabilities, there is going to be more testing that is done. And again, CDC just changed today the criteria, making it very broad, because they want to make sure that they're quickly identifying and detecting these cases so that they can isolate, because again, the worry is if that person doesn't have signs and symptoms and they transmit it to somebody who is very susceptible.
And that I want to touch really quickly on that self-isolation period. You know, we've seen citizens who've been quarantined on the cruise ship. We actually had a local couple who that happened to. They've been in quarantine for quite a while now. I think 12, 24, somewhere in that days. How concerned do you have to be after that isolation period? I mean, if you go 24 days and you're not showing symptoms, are you just not going to be sick?
Right. So right now, what they know about the virus is that the incubation period, meaning from the time they're exposed that you have signs and symptoms, is as long as 14 days. So that's why those people are kept under isolation quarantine for 14 days. But how long they can shed the virus, that's why they keep doing the repeated testing. And as you saw in San Antonio, they want to see 3 negatives. They want to see upper respiratory specimens as well as lower that come back negative, because they're trying to really understand that. How long can people potentially have this virus and shed it?
Still so much that's not known about this. Dr. Cervantes, thank you so much. Some great insight there. Ken.